It's time for Ask Our Docs, and right now we have Kimberly on the phone from Sweeney, Texas, who's worried about her 3-year-old son. So, Kimberly, what's going on?
My son is 3.5 years old, and he's very small for his age. He's been low on the growth chart since he was about 18 months, and he's still wearing 2T clothes. I was wondering if there were any tests he should be getting to make sure everything is okay.
Oh, this is a really good question, Kim. And we actually got your growth chart. I'm going to look at it here, and we can see where he falls. And you see, Travis, those lines represent what's normal. The top line is his height, and the bottom line is his weight. And you can see he's below what's considered normal for both.
His weight and height are represented by those two red dots,
That's
which are
right.
well below the
They're
normal
well
range,
below the normal. But Kim, you said was he growing normally at first?
He was, and then he just stopped gaining weight and stopped getting taller.
Okay, so at first he was growing within the chart, and then he kind of fell off the chart, and that's a little more worrisome to a pediatrician. You know, if they start small but then are growing at a normal rate, but just stay small and follow the curves, then I worry less about that. Now, you know, one thing I don't have is his complete record, so I'm not going to tell you exactly what you need to do. But you wanted to know, are there tests? And yes, there are. There's some blood tests. We can check his growth hormone levels, some other growth factor levels, blood counts, urine tests, kind of looking for chronic illness that would lead to growth failure. Also, we like to do x-rays to see, especially of the hand bones, to see what we call it the bone age, or I like to call it the hormone age. We can kind of see, you know, how old and how well his body's growing on the inside. And then we use all that information to kind of decide if he's deficient on a hormone or other growth factors, or if we can predict that he's going to catch up, depending on if his bone age is normal, that's one thing. If it's delayed, that's another thing. So we kind of use all those things. So you may want to just ask your pediatrician to see if we can do you know, some of these tests. You know, you don't have to go do all of them. I usually do it in a bit of a stepwise fashion. You know, start with the x-rays and an easy blood test, and then kind of go from there.
Okay. Thank you very much.